Our first speaker is Dr. Satish Gupta, the Secretary General of WCCPCI-2016 and the Chief of Medicine and Cardiology at Dr. J. Vachmal Global Hospital and Research Center, Mount Abu, to speak on coronary artery disease regression. Is it possible? Dr. Gupta, please.
Dr. Satish Gupta needs no introduction to this audience. He is the soul of the program. We see here, right from morning 4:30 onwards till 11 o'clock at the night. He is there almost in every program. The work done by him is known to the whole world. We were a part of it. Naveen was a part of it. And the Mount Abu trial is a very famous trial which has been published in Indian Heart Journal. And of course, it is the PubMed, Medline and MedSave, and a very, very powerful study. Without wasting any time, I'll request Satish to have his presentation on CAD regression. Is it possible? Dr. Satish Gupta.
Thanks. I thank you, Dr. H.K. Chopra. And my topic is CAD regression. Is it possible? Actually, it has been covered by Dr. Selvamurthy, Dr. Manchanda, Dr. V.K. Mishra. Most of the things have been covered. Yesterday the same presentation was there almost, because we have worked on the same project, Dr. W. Selvamurthy and myself. So I'll be talking to you on regression. As you are aware, coronary artery disease is a progressive disease. It's a lifestyle disease. And the question of decreasing it, previously it was thought to be a degenerative disease, but now we know that risk factors are there. If you can reduce the risk factors, you can change the risk factors, you can change the disease. As you know, what happens otherwise, what we do with PCI and CABG, the disease keeps on increasing. Like this person had I think I won't go into details, 2007 event, then had PCI, 2010 again PCI, then 2014, again he had bypass surgery, and within two months the symptoms again appeared, and then he went to Houston, and then all the grafts were found blocked, and then balloon angioplasty was done, and still after that 4 months later patient was symptomatic. So this shows that disease is progressive. Whatever you do, angioplasty or bypass surgery does not solve the problem. Like this person had all the grafts blocked within 2-3 months of bypass surgery, and all these stents also not working. And another patient, angioplasty in 2013, another angioplasty in 2014, bypass surgery in 2015. Again symptomatic. Then people with diffuse disease, 54% of Indians with CAD have diffuse disease, not amenable to PCI or CABG. The problem is there. Now how to regress this disease? Okay, primary angioplasty, even angioplasty, PCI up to 24 hours is good. But what about stable angina? I think Dr. Jagat Narula has talked very nicely on that. I need not repeat it. And the role of mind is very important, as I discussed in the morning. Heart, there is a physical heart and a subtle heart. That is intellect, consciousness. If we keep our consciousness clean and mind pure, mind positive, team positive, then we can open our blocks along with proper diet, proper exercise. I'll be sharing with you how we have done it. But there are few studies in the literature which I just would like to share with you. There are some studies you must be knowing that we can, by elevation of HDL, that is in the Nissen et al. Study, they had given ApoA1 Milano 15 mg per kg body weight and 45 mg per kg body weight, and it was shown that there was a 4.2% regression in atheroma volume. Then under Arbiter 2 study, again they showed the same thing almost. And then many animal models also they showed the regression. And then LDL and plaque burden. Many studies have come, plaque 1, regress trial, MARS trial, LCAD trial, MARS trial, and the reversal trial, reversal study which I like to quote. There are 502 patients in the study, and the LDL levels were 125 to 210 average LDL levels. And After they pravastatin in one limb, pravastatin 40 milligram per day was given. Another limb, atorvastatin 80 milligram per day for 18 months was given. And LDL came down to, in the pravastatin limb, to 110, and in the atorvastatin 79 milligram per deciliter. CRP decreased much more significantly in atorvastatin group, that is 36%, as compared to only 5% in the pravastatin group. And on CAG with IVUS, there was no change in the pravastatin group, while there was a 2.7% decrease in atheroma volume in the atorvastatin group. So this shows that atorvastatin is a better drug and high doses are better. Then prove it, TIMI 222 trial, established study, miracle study, TNT study. They all have shown that there is a significant decrease in coronary events and also decrease in plaque volume. Then another study which has been sort of done with blood pressure. If you can decrease the blood pressure of the patient, and then there's a decrease in coronary events as well as plaque volume. And they have shown that patients with diastolic blood pressure less than 100 milligram, they took about 1900 patients in their study, given amlodipine to 10 milligram per day and enalapril 20 milligram per day, either of the two to the patients, and it was seen that there was a 31% decrease in coronary events and 20% decrease in coronary plaque requirement for intervention. So with this, I'd like to focus on what we have done, how we have sort of shown the regression. You already know about lifestyle heart trial by Dean Ornish. Dr. Manchanda has talked about it. Then we know about Dr. Manchanda has done a nice study, and which was published in JAPI in 2000. It was done with moderate to severe CAD patients. And then Dr. Yogendra from Mumbai, that study also, again, but the results were not, it was no regression per se, but there was no progression. That is also an achievement. Now, what we wanted to look at in our trial, that is, we had two trials, Mount Abu Open Heart Trial and the Abu Healthy Heart Trial, which is a randomized controlled trial. And basically, we took meditation as the basic thing. Meditation as a way of life, Raj Yoga meditation as a way of life. Though I was asked by the Ministry of Health to add on asanas, breathing exercises, and other things in the study, but pranayama and other things, but I said no. We just use one Raj Yoga meditation as a way of life. Along with that, we'll have a meditative walk. The difference between the meditative walk and other walk is very high. So our walk was meditative walk with sunrise for about 30 to 45 minutes, about 110 to 120 steps per day. And then meditative sleep. Before going to bed, have meditation. First ventilate your mind, then go to bed. And try to sleep early, that is sleep by 10 and then get up early. And then third aspect was eating low fat, high fiber vegetarian diet. But not only what to be taken, but how to be taken in silence, in a meditative state of mind. And at proper time. Breakfast, lunch and dinner should be at proper time. And then de-addiction from smoking or alcohol, whatever. And in this, basically we have taught our patients. Patients came to us in the groups of initially 10 to 15 patients with the spouse. With the spouse, it was a must, and it was in-house program. And all the patients were they stayed with us for 7 days. And then first day we did psychological analysis. There all the patients were angiographic documented. They were referred from either from Ahmedabad, BJ Medical College, or Grant Medical College, or Delhi, Maulana Azad Medical College. And then we randomized them in two groups, intervention group and this group. I'll just come to the study directly. This is the study which we did, and Global Hospital Research Center in collaboration with DRDO and 3 tertiary cardiac institutes in Mumbai, Delhi and Ahmedabad. And this study was sponsored by Ministry of Health. And this study was published in Indian Heart Journal, as Dr. Chopra has told you. And this study stands as in the top 20 studies as informed by BioMedLib on the first number. top ranked in the top 20 studies. In 2013 it was informed to us, and then it remained to number 1 up to November 2015, almost 3 years. It was the most cited, most visited by the researchers and public alike. So this was a study where psychologists, physiologists, endocrinologists, cardiologists, clinicians, nutritionists, fitness experts and spiritualists worked hand in hand. And we looked into that Mount Abu open heart trial, which was an open trial, and then another was a Abu healthy heart trial, which is a randomized controlled trial. We had 2 groups. The difference between the 2 groups was only meditation. Diet was same, exercise was same, and only meditation was the main thing which was important. And angiography was repeated after 1 year. And all the parameters were done, psychological parameters, physiological parameters, that's brain rhythm, EEG, and the heart rate variability, and the stress hormones, happy hormones, and almost all the patients had the stress test. Few patients also had perfusion studies done. And all the angiographies were coded, and they were sort of blind to blind the group equation and to blind the angiography sequencing. A panel of 2 independent angiographers who were not connected with the study, they analyzed the angiograms. And all the statistics are also analyzed by independent people from ICMR and other DRDO. And our 80% patients had either DVD or triple vessel disease. Our average block was about 69%. And 93% patients could open their blocks as compared to only 13% in the control group. Average decrease in percent diameter stenosis was 11.82% as compared to 4.52% increase in control group. I'd like to show you some angiograms. You can see, I think this is not properly done. There's a 90% block in the here, and you can see that recent and very nicely the artery has opened up. You can see a long block, a diffuse disease, and it has opened up so nicely. And another block which is 100%. Actually, we had 33 lesions which were calcified lesions, and we did not, took these lesions in our study for analysis. But to our surprise, out of 33 blocks, 100% blocks also opened up. And this is one of them. This is another one. There are multiple blocks which all opened up. 80 and 90% block opened up. And the ejection fraction. This patient had 2 myocardial infarctions, anterior wall and inferior wall MI, and it improved significantly in the repeat LV angio. It became 45%. So there is a myocardial regeneration with Raj Yoga meditation. 80% block opened up, and the ejection fraction 20%, repeat angiogram, LV angio 50%. So our average increase in LVEF was 10% in the interventional group. Another 100% block opening up. And control group, you can see all the blocks increasing. This is what I want to tell you, that in this control group, they were given the same diet, same exercise and usual medical care, but no structured meditation. They were told to do whatever prayer they are doing asanas, or they are doing whatever they are doing, devotion, they were asked to continue with that. But the interventional group were given Raj Yoga meditation in a structured manner, how to manage each and every type of stress with Raj Yoga meditation. And what we saw, that the control group patients actually increased the blocks. And when many patients shifted from the control group into the interventional group after 2 years. And then we saw that the regression was observed. Another patient, block increased in the control group. Another patient who had from the interventional group a 100% block, calcified block, and the repeat angiogram, the whole territory opening up. And the psychological behavior. Actually, we have tried to correlate. Now we have a database of 7,500 patients, the psychological analysis and repeat angiograms. And now we can say that, actually we need a good statistician to analyze our study, to correlate psychological parameters with the scores with the angiographic sort of status. But what we can say now, that every block has a definite psychological pattern, thinking pattern. If you can change the thinking pattern with the meditation, then you can change the block. If you are not able to change the thinking pattern, then the block remains the same or it may increase. And the relationship between the decrease in the score was directly correlated with the decrease in coronary stenosis. So you can see that in the HLS group, healthy lifestyle group, type A behavior was significantly decreased, anxiety was significantly decreased, depression was significantly decreased, anger decreased, healthy lifestyle improved, and overall feeling of well-being improved. We had a sort of a group of scientists, psychologists from DIPR, Defense Institute of Psychological Research, who used to give counseling and who also assess the patients, not only for questionnaires, but also from, individual by individual interview. All the patients could stop smoking and alcohol in the interventional group, and the diet adherence and exercise adherence were much better. And you can see the EEG, the effect of meditation. You can see that, I think Dr. Salamurthy also showed this slide, days, baseline and day 7. Day 7 itself, you can see, there's a significant improvement in alpha rhythm, right? And the theta rhythm. And delta rhythm also improved. Beta rhythm decreased. If you see it over here, this is with eyes open, it is much better. And see this, alpha rhythm improving, beta rhythm coming down, and the theta rhythm improving, delta rhythm improving. That means now patient is at rest also, is at ease. And I think I'll just take another minute, and then I'll be over. And then you sympathetic activity. See this, low frequency power represents sympathetic activity, and high frequency power represents parasympathetic activity. On day 1, sympathetic activity is much more, and parasympathetic is not proper. Day 7 itself, there is significant improvement. And at 1 year, 2 year, there is a total harmony in sympathetic parasympathetic activity. And stress hormones decrease on day 7 itself. And the happy hormones, endorphin levels and serotonin levels improve. And the 8 a.m. cortisol levels and 4 p.m. cortisol levels decrease within a week and further decrease as the patient follows the program. Insulin sensitivity, there was significant decrease in improvement in glycemic control, along with significant decrease in insulin levels on the day 7 itself. That means better insulin sensitivity. The whole deadly quadret of metabolic syndrome is addressed by following this program. And I just skipped this, bad cholesterol, LDL decreased by 31%, HDL increased by 16%, and triglyceride decreased by 31% again. And decrease in LDL-HDL ratio significant. And the events, 9 versus 38, odds ratio of 11. And the simple take-home message is spiritual care first, that is 3-dimensional health care. Be natural, be inner self-conscious, not body or role conscious. And remember the 7 innate energies of the soul. And for this, practice morning meditation and to enjoy blissful stage. And up to 8, to harmonize your adrenal surge, try to remain in silence up to 8 a.m. And then for physical care, take proper diet, eat natural, sattvic diet, that is what, when and how. Be in the lap of nature, have morning walk and evening stroll if possible. Have proper sleep, go to bed early, get up early, and proper use of medication. And as and when intervention is required, go ahead with intervention. But remember, intervention are not the solution. They are only stopgap measures. Thanks.
Thank you, Dr. Gupta. Please have your seat. We'll come back to the chairman's comments.
Thank you, Satish. I think we'll have the discussion at the end. Satish, please join us in the chair here.